Medical specialties and procedures related to the female reproductive system. Gynecology. A gynecologist is a specialist in the area of gynecology, focusing on the diagnosis, treatment, management, and prevention of diseases and disorders of the female reproductive system. Obstetrics is a specialty that provides care through pregnancy, labor, and puerperium. Further subspecialties in women's health include contraception, reproductive endocrinology, infertility, adolescent gynecology, endoscopy, and gynecological oncology. Hysterectomy. A hysterectomy is done to stage or treat female reproductive cancers, treat precancerous conditions of the cervix, and some non-cancerous treatments that have not responded to other forms of treatment. There are 3 types of hysterectomy. A total hysterectomy removes both the uterus and the cervix. A subtotal hysterectomy removes the uterus only. A radical hysterectomy removes the uterus, cervix, part of the vagina, and ligaments. Sometimes the ovaries and fallopian tubes are removed at the same time as a hysterectomy is done. A bilateral salpingo-oophorectomy, or BSO, removes both ovaries and fallopian tubes. A unilateral salpingo-oophorectomy removes 1 ovary and 1 fallopian tube. Some female reproductive system vocabulary. Acanthosis nigricans is a disorder that causes darkening and thickening of the skin on the neck, groin, underarms, or skin folds. Acrocordons are skin tags or teardrop pieces of skin that can be as large as raisins and are typically found in the armpits or neck area. Amenorrhea is the absence of periods. Androgens are male hormones. Anti-androgens are a group of medications that counteract the effects of male hormones. Antibiotics, medications that stop bacterial infections. Antiretrovirals, treatment that works against the viral replication. Antivirals, treatments that work effectively against a virus. Asymptomatic, pertaining to without symptoms. Auto-inoculation, self-inoculation. Axilla, the armpit. Bartholin's glands, also known as greater vestibular glands, they are responsible to secrete mucus to keep the vestibular area moist. Bilateral, pertaining to both sides. Douching, washing the vagina with fluid. Dysmenorrhea is the name for painful periods. Dyspareunia is a name for painful intercourse. Dysuria is the name for painful urination. Endocrinology is the study of the endocrine glands and hormones. Endometrium, the innermost layer containing a connective tissue lining covered by epithelial tissue that lines the lumen. Provides the site of implantation for a fertilized egg. Sheds during menstruation if no egg is fertilized. Endoscopy, the process of viewing internally. The fornix, the superior portion of the vagina. Gametes, haploid reproductive cells that contribute genetic material to form an offspring. A gynecologist is a specialist in the study and treatment of the female reproductive system. Gynecology, the study of the female reproductive system. Hirsutism, excess hair all over the body. Homeostasis, biological process that results in stable equilibrium. Hysterectomy, the surgical removal of the uterus. Inferior, pertaining to below. Intramuscular, pertaining to within the muscle. Laparoscopy, process of viewing internal organs. Lumbago, lower back pain. Mammoplasty, surgical repair of the breasts, particularly after a mastectomy. Mastectomy, excision of breast and/or breast tissue. Oligomenorrhea, infrequent or irregular periods. Oocyte, a female gamete. Oophorectomy, surgical removal of the fallopian uterine tubes. Polymenorrhea, excessive bleeding during one's period. Polyuria, frequent urination. Proliferate, reproduce rapidly. Puerperium, time directly after childbirth. Superior, pertaining to above. Unilateral, pertaining to one side. Urethritis, inflammation of the urethra. Diseases and disorders of the reproductive system. Breast cancer. Breast cancer starts in the cells that line the ducts or the lobule of the breast. Some warning signs include a new lump in the breast or axilla, thickening or swelling, irritation or dimpling of the breast skin, redness or flaky skin, pain, discharge, all in the breast or nipple area, and change in breast size. Risk factors include family history, obesity, hormonal treatment, and changes in breast cancer-related genes, BRCA1 or BRCA2. Treatment includes chemotherapy, radiation, and surgical interventions such as mastectomy, biopsy, incision and drainage, and mammoplasty. Cervical cancer. Cervical cancer is typically a slow-growing cancer and is highly curable when found and treated early. Advanced cervical cancer may cause abnormal bleeding or discharge from vagina, such as bleeding after sex. It is diagnosed during a pap smear, which looks for precancers, cell changes on the cervix. The pap test can find cervical cancer early when treatment is most effective. The pap test only screens for cervical cancers. The HPV or human papilloma virus test looks for HPV strains, which is the virus that can cause precancerous cell changes. Almost all cervical cancers are caused by HPV. HPV is a common virus that is passed from one person to another during sexual contact. There is an HPV vaccine. HPV is a common sexually transmitted infection. Both males and females can be infected with HPV. Almost 3/4 of sexually active individuals have been exposed to HPV during their lifetime. There are over 100 strains of HPV, and some strains of HPV can cause visible genital warts. The warts are usually painless but may be itchy, uncomfortable, and hard to treat. Some strains of HPV cause cancers. HPV spreads through sexual activity and skin-to-skin contact in the genital area with an infected person. Since some people are asymptomatic, they don't know they have the virus and consequently pass the virus to their sexual partners.